Hey, welcome to Your Personal Health. I'm Jeff Harrison. Here in just a second, we're going to bring on Dr. Kim and Dr. Burris. But I just want to thank you for joining us. And we're going to dive into some very specific questions today. I just want to give them a second to catch their breath. They were just finishing up with the COVID-19 update on their show from 3 to 3:30. Hey, if you're not catching that, that is a great place to make sure you're on top of what's going on here in the Coachella Valley and Riverside County, for that matter, what's going on with the coronavirus and how it's affecting and impacting the valley. You know, today they had some great news. They talked about the school systems now, because of some lower elevations in the infection rate. We're seeing now that K through 6 have qualified to reopen, and they talked about that. So jump back over there. If you missed it, it is recorded. You can check it out. But now let's bring in Dr. Kim and Dr. Burris.
Hi, everyone.
How are you doing? Hey, I want to thank you guys for joining us. I know it's you guys jumped in right after the other show, and I really appreciate that. But I want to do me a favor. I want to ask some questions, really that tend to be very, very consistently asked by people out there when it comes to their health. And before we get started, though, take just a second, one of you, and tell us a little bit about Coachella Valley Primary Care, what it's about, who it services, and things like that. And then let's dive into these questions.
Right.
Okay, Dr. Burris or Dr. Kim, you want to take that one?
Sure, I'll take it. So Coachella Valley Direct Primary Care is primary care medical clinic where my wife and I started so that we can provide really good quality care in the Coachella Valley. And we wanted a place where people can feel like they're not a number. We don't feel like we're a number, and where we're able to do the things that we believe primary care doctors should do. And that's, being able to be kind of a central hub where we help people get healthier. And we can't do it alone. We realize that. There are a lot of moving parts to someone's health. And so we want to be able to partner with those healths in any way we can, whether you have insurance or no insurance. We can certainly help people do that, and we can spend the time doing that. And we did that with a model called direct primary care. And that all that means is we have a contract with each of our members that go month to month with a low fee, and it's just a one-time fee for that month, and you get a primary care doctor. And with that, we start making sure that you're moving in the direction you want to go to, and we want to help you get to your goals, whatever that is with your health. And we can do that by utilizing your insurance. And if you don't have insurance, we have partnerships with many places that we can still do many of the same things. And so part of the bonus is that the value is we are able to talk to you same day or next day, or see you same day or next day, because we think access is such a big important part of getting people healthy. Now, that's not all the time you need that, but when you need that, it's important. And so that's kind of in a nutshell what we wanted to provide, and that's the clinic that we have.
Well, thank you, Dr. Kim. One of the things you talk about, is primary care physician. Can you take a second, Dr. Burris, and tell us, by definition, what is a primary care physician?
A primary care physician is the doctor that takes care of most of your normal needs. So these are the people who you would go to for physical, but also the person that you would go to with illness, something like a cold, or if you were having a symptom that you weren't sure if it was serious or not. Primary care doctors fall into 3 categories in the United States. One is internal medicine, which primarily takes care of adults, pediatrics, which takes care of children, and family practice doctors who take care of all ages. We also have some what I would call specialized primary care, and that would be something like a geriatrician who would primarily take care of older people. And if you know anything about the way specialists work, specialists tend to be trained first as either a surgeon or an internal medicine doctor, and then after that they specialize. And they may specialize in surgery and become, say, a neurosurgeon, or they may specialize under internal medicine and become a cardiologist or a neurologist. So if you think about it that way, primary care is sort of the umbrella under which all the specialties fit. And because of that, your primary care doctor should know a wide range of information. They should know about a lot of diseases, but they won't be the person who necessarily has expertise in managing a rare condition. That would be a specialist. Unfortunately, in the United States, what's happened over the last 25 years is primary care doctors have become labeled as gatekeepers. And so it seems like they've turned the primary care physician into the person you need to go to get permission to go see the doctor that's going to help you. And that is not what primary care was designed for, and it's not what it should be. Your primary care doctor actually should be the person who the specialist can call if they have a question about the patient and they know the answer, and so they should be the person who's coordinating. If a patient needs multiple specialists, they should be the one who knows what's going on with everyone, so that when that patient has a problem, they actually know what's happening in all the different doctors they've been seeing, so they can sort of, keep an eye on the big picture. There are also the doctors that in our system are tasked with preventive care. So the people who make sure that we're looking ahead and keeping a patient healthy down the road, managing risk factors, things like high cholesterol and high blood pressure, doing cancer screenings. That sort of falls under the purview of the primary care doctor, along with immunizations.
It seems like, Dr. Kim, that more and more over time, we've become less, as you're saying, we should be coming, Dr. Burris, we should be coming and creating that relationship with our primary care doctor. And the primary care doctor then is really not the gatekeeper, but really almost like, I think of like a traffic controller. And I'm thinking those jets in the air are different doctors, whether it's a cardiologist or it's, whatever it may be. And you're actually making sure that the communication with all these other doctors, whether it's medication, it's current health of the patient, whatever it is, that seems to me like that makes a lot of sense. But Dr. Kim, it's changed a lot, hasn't it? I mean, don't we seem to now almost skip the most critical step, and that's to have a primary care physician?
No, that's definitely true. And one of the reasons is because primary care doctors have had to increase their volume of who they see on any given day. So used to be you would see 10, which was very manageable. Then it went to 20 and 30, and some of them are seeing 40 a day now. And because of that, there's just no time to be able to sit there and manage each single person unless they had one problem and it was very, very simple. For primary care, we should be able to handle high blood pressure and diabetes and seizures to a point. And there will be some patients that are more complex that we need help from specialists. But it's gotten to the point where even the simple stuff takes time. And with that many people rolling in the clinic, you just don't have that kind of time. So you farm it out to the specialists. And now the specialists are happy to do that because they're getting reimbursed at a higher rate. But then they're the ones that are seeing these patients, and it's harder to get into your primary. So then the medications are controlled by the cardiologist, whereas the primary care doctor really should be the one-stop hub of everything for most things. And you're going to your primary care doctor to get your meds, and the specialists are just adding value and helping and saying, yeah, they look great, we'll see them back in a year. And the primary care doctor then makes little tweaks when there's needed. But it kind of is turned the other way around. So,
Dr.
Yeah.
Burris,
Oh,
I'm sorry, I was going to ask you, Dr. Burris, as a follow-up, and then please take your response first. But how is it rare, or is it more common now when people come to direct primary care and they're there for the first time, and you probably start discovering information about them, and you find that there potentially are some prescriptions from different doctors that really don't work well together, or not only medications but also protocols that aren't working properly. Do you ever see that, Dr. Burris?
I do, unfortunately, and sometimes what happens is doctors, we ask the patient whenever they come in which medicines they're on, but if the patient doesn't remember one, or if it gets prescribed later and they forget to tell their other doctors what they've got, what will happen is you either end up with a medication that has a bad reaction with one of the other meds, or you end up with duplicates of medications. And I see that all the time, where people come in with 2 bottles from 2 different doctors for the same medication, except one has like a trade name on it, so they didn't realize it was the same one. And that, it's a risk. And honestly, there's been some work within the larger system to try to cut back on that. Like your pharmacy usually checks that, and your insurance company sometimes will flag it. And then if you're going to doctors within the same system, they'll often flag it as well. But it still happens. And the other problem that I see all the time is that a patient gets admitted to the hospital, and when they're discharged from the hospital, medications don't make it. They get dropped off their list. And often they come back to their doctor in 3 or 4 months, and they're just not on 2 of their blood pressure meds or something. One of the things that I was going to say is it's not uncommon for me to have patients come in who say, oh, I only go to my cardiologist, for my blood pressure medicine. And I'm thinking, oh my goodness, they must have this really hard to control blood pressure if a cardiologist needs to control it, And I look at their list and they're on one medicine at a low dose. And I'm like, why are you going to a cardiologist for this? This is an easy fix. This one's not a complex issue. But what happens then is if they're seeing just their cardiologist and they have no other reason to go to their primary care doctor, nobody talked to them about, monitoring them for colon cancer, or, updating their flu shot that year, or whatever it is, or even the stress that they're under and the fact that they're not sleeping well and how that's affecting their overall health and the relationships within their family. So a primary care doctor is going to kind of, or should have their eye sort of on all the issues, big picture, and be helping the patient utilize the specialist for what they're really good at, which is complex specialty issues. So there are definite need for specialists, and we use them all the time. It's just that right now things have gotten really out of whack, and I don't want my cardiologist buddies spending all their time managing easy blood pressure patients, because there's plenty of more difficult work for them, which I'm sure at some point they would agree with.
It almost sounds like somehow, as you say, it got out of whack. It sounds like we're trying to hang, pictures on the wall with a sledgehammer, and instead of using the right tool, or watering the garden with a fire hose and wondering why we're blowing all the water out. And so let's talk a little bit about, the difference in the role, and what are the primary care physician's role in our health journey. We've talked about that a little bit kind of peripherally, but do me a favor, Dr. Kim, and jump into that. And what are what is your role in our health journey?
Sure. I mean, so we were trained, and like Dr. Burris said, most specialists are trained on the general level, whether you're a surgeon or a non-surgeon. Those are the two, I guess, splits you get. Everyone gets trained as a overall generalist, and then there are doctors that continue that, so they get better at knowing a lot of things. What could a lot of things be? Or you can choose the path of getting specialized. So now I'm going to learn only about the heart, or only about the gut, or only about the brain. Or I'm going to be a surgeon only that does heart surgery, or I'm going to be a surgeon that only does intestinal surgery. And so we need those specialists because there are complex issues. But they have moved away from being what really could, my elbow hurting be or my chest pain be, because not all chest pain is a heart attack. And so primary care doctors are really supposed to be kind of the person that you go to, that you've built a relationship, they know you, and you can have access to them, and they're the ones that help you figure out, okay, how do I get you healthy overall? What's going on right now? And who do we need to get involved in order to get you better? Maybe it's we can handle it here, or maybe it's no, we need specialty help. And then interfacing with you in the system, because it's great that if we can do it all here, but then when we need to have you interface with a specialist, you go out on your own. That can be hard too. I mean, we've done it ourselves personally in our personal lives with our parents. And so, we're primary care doctors really should be interfacing with everyone, making sure that everyone is on the same page, and making sure that the primary care doctor really knows what's going on, so that if things change, we can be the ones that say, given all the context, maybe this would be the best course.
Well, I have a little bit of a follow-up question, so I'm going to leave you there for a second. But and again, coming from a layman position, and what I'm hearing, do you, as the primary care physician, if it's that ideal journey, you're the one directing your patients to a specialist. The specialist then you would get communication back from them, whether they've added a medication or whatever it might be. And so you're keeping that, I'm going to use it as called a diary or journal on that patient, correct?
Correct.
But if that patient now goes out on their own and goes out for, goes to a orthopedic surgeon because they got something on their elbow, is it unlikely, or is it likely to be thought of it that then there's not the communication coming back to you, and you may not even know they went to that doctor?
Yeah, that can happen for sure. A lot of the orthopedic surgeons will ask who your primary care doctor is and send information, because they don't want to be responsible for, I guess, the whole care. Because as a doctor, if they have someone come in and they do their blood pressure and the blood pressure is high, they're not responsible unless they say, oh, I'm going to send you back to your primary care doctor because they will handle your blood pressure. We're just the bone doctor. So, but if you go to them, they will certainly help you with your orthopedic needs. But then there's that risk of not getting the communication back, or things getting missed, if there's not that communication between the primary care doctor, who is really trying to think of you as a whole.
Gotcha. Dr. Burris, earlier in the first part of the show, we were talking about primary care, what the definition was, and Dr. Kim mentioned family practice. I'm curious, what's the difference between a family practice and primary care?
So primary care was an approach to medicine that came about in the 1970s. And basically what happened at that time was most of the doctors in the United States were specialists in some respect. And there was this understanding that we were missing this really well-rounded, well-trained generalist. And we had at that time doctors called GPs, but they only had 1 year of training.
Mhm.
So primary care came about really as sort of a movement, and family practice came out of that. And what family practice is it's an actual specialty that you go to a residency for, and you have a very particular, areas of study that you have to do. Family practice doctors actually are trained in surgery, they're trained in OB, they're trained in pediatrics, and they're trained in internal medicine. And what you'll see with most family practice programs is that they're really focused on training doctors who are going to be outpatient clinical doctors. So your community physicians, maybe even ER doctors in rural hospitals.
Mm.
So that's the sort of focus of their training. Um, and that was, something that sort of transitioned over the years. Internal medicine is, again, it's the soup from which the specialists come. So this is a training program that really is more focused on hospital-based care. They still do outpatient care, but a lot more close association with other specialties. Um, and so you'll see a lot of people who are trained in internal medicine go into careers as hospitalists, where they practice more in hospitals. Having said that, there still are a large number of internal medicine doctors in the community. I am an internal medicine doctor. Mike is a family practice doctor. I
Mm.
did a specific program called MedPeds. So I did both internal medicine and pediatrics because I really wanted to expand my ability to treat people, but I wasn't interested in doing the surgery and the OB parts of the training. And so we complement each other very well because Mike is actually had a lot of experience with procedures in his training, which, and I had a lot of experience in ICU and ER that I can draw upon, as well as more subspecialty rotations. So more time spent in endocrine, more time spent in pulmonary, et cetera. So we're able to sort of draw on those different training backgrounds to really bring to our patients the best of both worlds.
I think that's great. The fact that you both you're not duplicating service as an example. Is that what I'm hearing?
We're complementing and we overlap quite a bit. But one of the great things about working with other physicians is that it's fairly collaborative. And it's nice to have slightly different skill sets that you bring to the table when you do get into a situation where you're like, what should I do next? Being able to um, bring in somebody to the conversation that has a slightly different perspective is often useful. And that's when we often will also bring in our specialists. Um, but even in the primary care world, we all have things that we're really interested in and we've, spent time exploring and reading about. And so we all have our little areas of expertise, even within primary care.
Dr. Kim, just if you could help us just to kind of wrap up. I know you've had a long day with the shows. I appreciate this, but talk about what are the services of a primary care physician. I know we've talked a little bit about it. Uh, Again, a little bit at a time, but do me a favor. Not only what are the services of primary care physician, but talk to us about the program that you have at Coachella Valley Direct Primary Care and how people can get involved.
Sure. Well, first of all, I have to say, Dr. Burris is the brains of the operation. So, in terms of overlapping, you're going to get, she's the brains, I'm the bronze. No, I'm totally teasing. In terms of the services that primary care offers, that's always kind of a hard thing to describe because being that we're trained in a lot of things that we do, we want to be able to, as safely as we can, help people in many different ways. So whether that's, preventative care, or that's, you come in because you cut yourself, we can sew you up. If you have a nosebleed, if your toenail's ingrown, if you have an abscess, so there's a lot of things that primary care doctors know how to do, and they're good at doing. Hey, what is this bump or this spot I have, or why is my eye red, and stuff like that. So in terms of what we can do, the scope is pretty broad, and that's what we offer here as well. We'd like to say we are able to actually do the things that primary care doctors want to do, because we have the time to do that, because we don't spend only 10 minutes with our patients because we have another patient to run off to. And so being able to do those things and offer those things, I think, in a place where people know you and you don't have to run off to a different specialist, is something that primary care doctors want to do, because it's, some of the procedures are really fun to do. Not fun as in, I want to experiment, but that's part of why we become primary care doctors, is because it's not just what's your blood pressure, let me listen to your heart, oh great, let me write your prescription, and off you go. I mean, there's a variety of things that come in on a day-to-day basis, and being able to look in someone's ear and treat their infection, and then something else on the toe and all that, is kind of the variety of what primary care is and what makes it fun. And getting to know people, the stories, and they know you and you know them, and every interface is getting to know them more and more, is kind of what primary care is. So
on the screen, we have the information on how to contact Coachella Valley Direct primary care physicians. And as it says, they're changing the way you stay healthy. One of the things is, you guys described this today, and if I'm off course, which sometimes my wife will remind me I am, but if I'm off course, it feels like, as you describe your program at Coachella Valley Direct Primary Care, it feels like it's the place I should go first before I even think about going to ER or an urgent care. Because what you described, sometimes you walk into urgent care and people are in there for those very things when they could just be coming to you. Why is that?
Usually it's an access issue, and a lot of what happens in an urgent care is either because the person doesn't have a primary care, or they can't actually get into them in a timely manner, or it's after hours or on the weekends. So in our system, we want to be cutting down on people's need for those type of services. So if we can take care of a question, sometimes that's all that's needed, or a refill, or we can bring somebody in for an acute issue and keep them out of urgent care. That's really what a primary care is supposed to do. But unfortunately, a lot of people either don't have a primary care doctor, or when they call, there isn't an appointment available in a reasonable amount of time. So that's really what's driven the explosion of urgent care, really, is this inability to access primary care.
Well, if you're having trouble with that, if you're having a difficult time either accessing a primary care physician, or because there is a shortage across the U.S. and yes, even here in the Coachella Valley, of finding a direct primary care, consider Coachella Valley Direct Primary Care as your alternative. Speaking personally, as my wife and I are both members, yes, unfortunately, or I guess fortunately, we are in that 46 and older. But if you're under 40, 46, it's just $99 a month. And then after that, it's $145 a month. And the nice thing about it is, if I could, I can do it virtually like this and say, hey, look at this spot on my hand. What do you think? And I know it, you've had me take pictures of things, a little spot on my leg, and take care of that, to where setting up things for my wife to go see somebody to have an MRI on her wrist, it just made life so simple. And just knowing that you're in my corner is already relief. If you're having difficulty, that, do me a favor, I'm going to put the information on the screen one more time, and just make a call. I'd love to hear the phone ring right now. It's 760-642-5600. 5549, or just go to their website for more information, CoachellaValleyDPC.com. These two are great. They're really pioneers of what they're doing. They're taking their wide, as you've heard, their expertises and saying, hey, we're going to fill a need in a different way. So you're not sitting in the ER or the emergency room, or I guess the ER or urgent care, for hours on end when you could be in and out literally in minutes and have, I don't want to, no disrespect to anybody, but probably have better care. Am I off base on that?
I also work in urgent care, so I'm not going to diss
I knew that.
But, it is often better care if it's given by somebody who knows your whole history. Yeah. So they're able to make quicker and more accurate diagnoses, for instance, because they've seen you have this problem before, for instance. So I think that it's ideal if it can be done in the primary care setting.
Perfect. Well, guys, thank you so much for joining us again today for your personal health and really helping us fill in that gap of, hey, what is a primary care physician? What's the difference between a primary care physician and a family physician? What role do you play in our health journey? And what services can we expect from a primary care physician? You answered all those questions today. I just want to thank you so much and wish you guys a safe week and weekend. And I just have to ask, because I heard on the other show, both of your children, are they of the age where they're past K through 6?
We have 3 children, and so we have one in the younger group, and the other 2 are in the older group.
Gotcha. Okay. If you don't know what I'm talking about, go check out the show on Facebook and look at the show from 3 to 3:30. It's the COVID-19 update for 2/24/21. Guys, thank you again. Be safe. And until next time, keep your distance, wear your mask, and go to Coachella Valley Direct Primary Care at 760-642-5549 and take care of your health the way it should be. Bye-bye.